Howdy, my name is Jonathan Weatherman. I am a member of Group 511. Our group consists of me, Jada Samuels, Anna Vieira, and Caroline Hall. And today we will be presenting to you a presentation on the eye and two different diseases that affect the eye, those two diseases being conjunctivitis and glaucoma. So both are very prevalent diseases. Now, the eye is a special organ in that it allows us to see the world that we're surrounded in, see the beauty of it. It specifically can detect light and transmit this light along the optic nerve to our brain to allow us to perceive the images that we are seeing. It allows us to see different colors, allows us to see depth perception, and overall just is our gateway to the world and to being able to see. So since it has this complex function, it is comprised of a variety of different types of tissues, and therefore it is affected by a variety of diseases. Now, one of these diseases that is very prevalent is conjunctivitis. Conjunctivitis has about 2 million cases per year in the United States. What it is it's the inflammation of the conjunctiva, which is the outer thin transparent layer of your eye, often called the white of your eye, covers the white part of your eye, and this is just an inflammation of it. So as you can see down here, this left picture illustrates a normal conjunctiva where it's the white part is healthy and it's good, and on the right it's very inflamed, very red, and very irritated. Now, there are many different causes of conjunctivitis, the three main ones being bacterial infections, viral infections, and allergic reactions, and there are many different treatments that vary depending on the cause of conjunctivitis. Now, these are the pictures here. This top one is just a normal histological view of the conjunctiva of the eye, and here you can see the inflammation that is going on due to conjunctivitis, and in this histological view you can see the inflammation around the vascular portion that is being caused by conjunctivitis, which is one way to characterize it. Now, there are three main causes of conjunctivitis, as discussed before. That is a bacterial infection, a viral infection, and allergic reaction. The most prevalent and most contagious of all three of them is a viral conjunctivitis. Bacterial is also contagious, and allergies are not contagious. They're just unique to you and the allergens that affect you as your person. So, bacterial conjunctivitis is often characterized by this yellow mucus that forms on the outer portion and projects from the eye whenever you do have a bacterial conjunctivitis infection. Viral conjunctivitis, as others, is characterized by red swelling and also tear production, and allergic conjunctivitis is characterized by even more tear production than the viral conjunctivitis. So now that we've discussed what conjunctivitis is and the primary causes of it, I'm going to hand it off to Caroline Hall, who will explain to you the symptoms, treatments, and diagnosis for conjunctivitis.
Howdy, my name is Caroline and I'll be introducing symptoms of conjunctivitis. So, like Jonathan said earlier, most of the symptoms are pretty visual in nature. So, you'll see the redness of the conjunctiva right here, and then the discharge that happens, as well as the excessive tearing. And then down here, you can also see that there are little bumps that happen on the inside of the eyelid, and this is what causes most of the redness and the inflammation, as well as the excessive tearing. So, other than these visual symptoms, what you'd feel if you had conjunctivitis would be a gritty sensation, itching and burning, and then an increased sensitivity to light. But then, other than that, you just see the visual stuff like the excessive tearing, the discharge, and then swollen eyelids, as well as the pink discoloration to the white of the eye. And with that, we'll go to diagnosis. So, usually, what a doctor will do to diagnose conjunctivitis is take a patient history. And this happens whenever a doctor asks about symptoms, when they began, and then other general health questions like what kind of irritants the patient was exposed to. The next step would be an examination. So the doctor would use an ophthalmoscope to use a bright light and magnification to examine the conjunctiva of the eye, as well as any surrounding eye tissue as well. The next step would be testing. This is usually for more stubborn cases, like chronic cases that don't respond well to treatment, and this would be done using cultures and smears of conjunctival tissue. So, in order to treat conjunctivitis, it really depends on the form that it's in. So, allergic conjunctivitis, really just removing and avoiding the irritant is what does the trick most of the time, but symptomatically, you could use cold compresses, artificial tears, nonsteroidal anti-inflammatories, and antihistamines. And then for bacterial conjunctivitis, improvement typically takes 3 to 4 days after treatment with antibiotic eye drops and ointments. And then for viral conjunctivitis, you really just need to let it run its course. The most you could do is symptom relief, which would be cold compresses, artificial tears, and then steroid drops to help with inflammation. And then with that, I'll pass it on to Anna for glaucoma and its different types.
Hello, my name is Ana Viera, and today I'm going to introduce to you an eye disease called glaucoma. Glaucoma is a disease that damages the optic nerve in the eye, and this condition gets worse over time, and it's often caused by buildup of pressure inside of your eye. This condition tends to run in families, and usually the patients that do have it, they usually don't get it until later in life. Glaucoma starts off by having few to no early symptoms, or basically they have no pain or discomfort. However, if glaucoma is not treated, patients might have permanent vision loss or even total blindness within a few years. Therefore, to prevent any type of eye diseases or eye conditions, it is highly recommended and advised by physicians to go visit your eye doctor regularly. Now I'm going to talk about the two types of glaucoma. The first one is primary open-angle glaucoma, and this one is the most common one. It usually happens when the eye doesn't drain fluid as well as it should be. In a healthy eye, the excess fluid leaves the eye through the drainage angle, which keeps the eye pressure stable. But in primary open-angle glaucoma, it's like a clogged drain. So the eye pressure builds up and it starts to damage the optic nerve. And this type of glaucoma is very painless and it causes no vision changes at the beginning. But there's a few people that have optic nerves that are sensitive to normal eye pressure. So they might be the ones that are in higher risk of getting glaucoma than normal eye pressure people. Therefore, regular eye exams are very important to prevent any type of glaucoma. Now I'm going to talk about the angle closure glaucoma, and this one occurs whenever the iris is very close to the drainage angle within their eye, and the iris can then end up blocking the drainage angle. So once the drainage angle is fully blocked, the eye pressure starts to rise very quickly. And whenever this happens, it's called an acute attack. Once you get an acute attack to form, that's whenever you should go see a doctor as soon as possible, because you might go blind right away. Therefore, these are the types of glaucoma.
The only sure way to diagnose glaucoma is with a complete eye exam. A glaucoma screening that only checks eye pressure is not enough to find glaucoma. During a glaucoma exam, your ophthalmologist will measure your eye pressure, inspect your eye's drainage angle, examine your optic nerve for damage, test your peripheral vision, take a picture or computer measurement of your optic nerve, and measure the thickness of your cornea. There are several treatments for glaucoma. Glaucoma damage is permanent, therefore it cannot be reversed, but medicine and surgery can help to stop further damage. Glaucoma is usually controlled with eye drop medicine. Used every day, these eye drops lower eye pressure. Some do this by reducing the amount of aqueous fluid the eye makes. Others reduce the pressure by helping fluid flow better through the drainage angle. There are two main types of laser surgery to treat glaucoma. They help aqueous fluid drain from the eye. These procedures are usually done in your doctor's office or in an outpatient surgery center. So, a trabeculoplasty is a surgery for people who have open-angle glaucoma. The eye surgeon uses a laser to make the drainage angle work better. That way, fluid flows out properly and eye pressure is reduced. The next one is the iridotomy. So this is for people who have angle closure glaucoma. The doctor uses a laser to create a tiny hole in the iris. This hole helps fluid flow to the drainage angle. Some glaucoma surgery is done in an operating room where a new drainage channel for the aqueous humor to leave the eye is created. So for a trabeculectomy, the eye surgeon creates a tiny flap in the sclera. He or she will also create a bubble, like a pocket, in the conjunctiva called a filtration bleb. It is usually hidden under the upper eyelid and cannot be seen. Aqueous humor will be able to drain out of the eye through the flap and into the bleb. In the bleb, fluid is absorbed by the tissue around your eye, lowering eye pressure. The implantation of drainage devices is also an option. Your ophthalmologist may implant a tiny drainage tube in your eye. The glaucoma drainage implant sends the fluid to a collection area called a reservoir, and then your eye surgeon creates this reservoir beneath the conjunctiva. The fluid is then absorbed into nearby blood vessels.
So, exam question number 1. Start with a little easier one for the first one. So, conjunctivitis is caused by which of the following? Bacterial infection, A, B, a viral infection, or C, an allergic reaction, D, both A and B, or E, A, B, and C. So, as we had discussed before, conjunctivitis is caused by all three of them. So, the answer would be E, A, B, and C.
So here we have exam question number 2. So what action or actions is or are characteristic of a glaucoma exam? So from a previous slide, we know that a measure of the eye pressure is taken. Your ophthalmologist will also do an inspection of the eye's drainage angle. However, a measure of the thickness of the lens is not taken. A measure of the thickness of the cornea is what's taken and not the lens. Therefore, the answer to this question would be both A and B, and that would be option D.
Exam question number 3. Which of the following conjunctivitis types and treatments do not match? A. Allergic conjunctivitis with nonsteroidal anti-inflammatories and antihistamines. B. Viral conjunctivitis with antibiotic eye drops and ointments. C. Bacterial conjunctivitis with nonsteroidal anti-inflammatories and antihistamines. D. B and C. Or E. None of the above. And the answer is D. B and C. So B is viral conjunctivitis with antibiotic eye drops and ointments, and C, bacterial conjunctivitis with nonsteroidal anti-inflammatories and antihistamines.
We'd just like to say a quick thank you to all of our sources for the information they lended to our presentation to be able to give us pictures to use as well as the information to share with you. We hope this presentation has been enjoyable and informative for you, that you're able to learn a little bit more about conjunctivitis and glaucoma and their causes and how to fight against them so that you can be aware of it for not only yourself but for your family members and others in your life. So we hope you enjoyed the presentation and that you learned something from it. Thank you.